started the timer and here is your question. Right, so if you have read and understood considering this surgical and augmentation, kindly tell me how would you define this area between vertebrae behind and sternum in front? What is this area called and how is it divided?
It is called the mediastinum.
Yes.
It's the space. Yes, it is divided into superior and inferior. Inferior
Yes.
mediastinum is again divided into anterior, middle, and posterior mediastinum.
Yes. Can you please tell me yes, contents in each of these mediastinum parts?
The superior mediastinum, it contains esophagus, trachea, thymus, origin and insertion of certain muscles such as sternohyoid, sternothyroid, and longus scula. Yes. Also, it contains
yes.
Also, it contains nerves like vagus and also upper part of thoracic duct.
Okay, good. Right. Can you tell me the contents of the posterior mediastinum?
It has descending part of aorta, azygous vein, sympathetic trunk, thoracic duct, and esophagus.
Okay. Can you please tell me the course of the sympathetic trunk?
Yes, ma'am. Thoracic sympathetic trunk is it forms from the up to the diaphragm at the level of T12 to become continuous with lumbar sympathetic trunk.
Yes. What type of fibers join to form this? Can you please tell?
It is postganglionic fibers
yes.
of the sympathetic ganglia.
Yes. It's preganglionic fibers that come and they correspond to the spinal nerves. Okay, can you please tell me how this sympathetic trunk is connected to the spinal nerves?
Via gray and white rami communicants and ganglia is communicated.
Yes.
Laterally.
Yes. Then can you please tell me how this sympathetic nerve leaves the sympathetic chain?
Sorry, ma'am.
How the sympathetic, because the sympathetic chain has nerves, right? So how these sympathetic nerves, they leave the sympathetic chain?
I would like to come to this later.
Okay. Can you please tell me, you mentioned, can you please identify and tell me what is this arrow pointing at? What is
this? Is
it's 27.
This is spinal nerve and intercostal vessels.
Okay, can you please identify this 3?
It's greater and lesser splanchnic nerves and branches of sympathetic trunk which form branches around pericardial bronchial vessels.
Okay, can
And
you
is-
identify the structure 1, please?
This is azygous vein.
Isn't it little thick for being an azygous vein?
Um,
Okay, can you please tell me the branches of
yes.
the ascending aorta?
Yes, ma'am. It's right brachiocephalic artery and common
Ascending
carotid,
aorta.
left common carotid and
Okay.
left.
Yes.
It's ma'am coronary arteries and
Yes.
anterior
Yes. Those. Tell
right
me.
and left coronary arteries.
Yes.
Yes.
Arising from how many
Ascending
cusps
aorta.
there? Yes. But aortic cusps. How many cusps are there in the aortic valve? And from which ones do they arise?
There are two cusps
Three.
and from corresponding sinus
Yes.
they arise.
Okay. It's three. Can you please tell me the tributaries of azygous vein?
Yes, ma'am. It's ascending right lumbar, subcostal. On the right lower side, right posterior lower intercostal.
Yes.
Then hemiazygous, accessory hemiazygous, and intercostal.
Okay.
Also, it receives branches from cardiac
And bronchial veins as well. And pericardial. Okay, you missed those. All right. Can you please tell me what else is present in the middle mediastinum? What are the contents of middle mediastinum?
It's mainly heart, heart and great vessels and
Yes.
pericardium.
Yes. Okay. What is present in the anterior mediastinum? What are
There
the
is
contents of and the
yes,
boundaries of anterior mediastinum as well, please?
it is formed between posterior border of body of the sternum and anterior part of the pericardium.
Yes.
Below it is formed below it there is superior part of the diaphragm and above imaginary line passing from angle of fluid to T4 vertebra. It contains thoraco-pericardial ligaments, certain lymph nodes, loose areolar tissue,
Yes.
and also lower part of nose.
Can you please tell me the extent of mediastinal pleura?
Yes, ma'am. It extends superiorly above the first rib.
Yes.
And it can be identified by surface marking from a sternoclavicular joint and a curved line up above that, up to the point around 3 centimeter above middle and medial part of the clavicle. And anteriorly, it extends below uh, 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 at the anteriorly parasternal area, and then it goes 2 centimeter below the lung margin, inferior lung margin, that is 8th and 10th.
Okay, good. Can you please
posteriorly.
tell me what do you understand by the term thoracic outlet syndrome?
It is a syndrome of neurovascular compression caused
Yes.
due to compression of the brachial plexus and subclavian artery between scalenus anterior and medius muscle.
Yes, good. And that leads to neurological and vascular compromise of the arm. Okay, can you please tell me, last question, what is subclavian steal syndrome?
When there is occlusion of the proximal part of subclavian artery, the distal subclavian artery tries to compensate by taking blood from vertebral artery, and when there is excess, when person does exercise of the arm, there would be ischemia of the brain.
Okay,
It is called as subclavian steal syndrome.
Good. Now, can you tell me how sympathetic nerves sleep? You already know there are ganglias, if you can think, in the sympathetic chain. Plexus.
Yes, ma'am.
Now remember?
Preganglionic and postganglionic fibers.
Yes, but then
And
there are like
also-
around the cardiac, and then the pulmonary plexus, then the great splanchnic nerve, lesser splanchnic. These are the plexuses through which these they leave sympathetic
Yes, yes.
nerves.
Greater splanchnic nerve is formed between the T4 to T8 nerves, and it goes to the celiac ganglion below
Yes.
diaphragm. Lesser splanchnic is from 9 to 11, 10 to 11, and it goes again to the celiac ganglion or sometimes suprarenal or adrenal ganglion. And least splanchnic ganglion or renal ganglion, it can be called. Least splanchnic is formed by T12 part of the sympathetic trunk.
Thank you. Started the timer.